Hi, everybody. We are going to be talking about the structure of the shoulder, so the ligaments and some of the internal structures that are contained therein. We need to understand how the shoulder is put together in order to know how it works. So let's go right to it. Here we are. We are actually on page 102 in your book, which is at the end of the chapter. But since we put muscles on top of the bones, it's good to understand the ligaments and other structures that are there as well. So this is the first view that they show. And what we're seeing here are all of the ligaments that hold the shoulder girdle together. So here's the clavicle right there. This, of course, is the scapula, this white bone here. And then this is the humerus, this bone. So all of these ligaments here are lashing everything together and keeping everything in place. So what we have here are ligaments that attach the clavicle to the coracoid process. And then over here, we have ligaments that attach the acromion to the coracoid. And right here, we have a ligament that attaches the clavicle to the acromion. So when you see names of these ligaments, they are going to be similar to what we talked about before in our word combining, where you drop the last letter of a word, add an O, and slam the two words together. So here we have acromioclavicular. It is a ligament that attaches the acromion to the clavicle. So here's the acromion, here's the clavicle, here's the acromioclavicular ligament. Most of the time, that's the way the ligaments are named. Sometimes you have different ones like trapezoid or conoid ligaments, and those are named really more for their shape. Anyway, so here you have the coracoacromial ligament, right? Coracoid process to the acromion process. Drop the last letter, I don't know, smash it together. Okay, so what I really want to talk about, though, is the glenohumeral joint capsule. In here is where the head of the humerus meets the scapula, okay, in the glenoid fossa. And if you recall, the shoulder joint itself is one of the most least stable joints in the body. The small, teeny tiny glenoid fossa does not do very well at holding the head of the humerus in it. So we have this large, almost continuous ligament called the glenohumeral joint capsule. There are different sections to this, and they actually have different names. But we can just call this whole thing the glenohumeral ligament, really, and be done with it. That is the primary ligament that holds the joint together. I also wanted to draw your attention to the biceps brachii tendon. That's the tendon of the long head of biceps brachii. You have this little sheath around the long head of biceps. That sheath has fluid in it. And what that does is it prevents friction of the tendon over the bone. Because if you had the tendon constantly moving over the bone, it would be like a rope over time on something metal. Every time it went back and forth, it would just wear it away and wear it away and wear it away. And then eventually the tendon itself would fray and maybe snap. We can't have that. So we have this fluid-filled sheath around the long head of biceps brachii. Now that fluid-filled sheath can become inflamed, and that's called tenosynovitis, and we'll talk about that in another video. Okay, so let's see what's on the inside then. This is a cross section, and we're looking at the anterior view of the shoulder. So this is the humerus. This is the head of the humerus. I mean, it looks like it, right? This is the teeny, teeny, tiny glenoid fossa right there. It's so small. See, it really doesn't hold the head of the humerus at all. Hence the glenoid ligament, the glenohumeral ligament that has to hold this whole thing together. All right, so what do we have here? Well, a couple of different things that I'd like you to take note of. First of all, you see this whitish, bluish stuff right here. This is cartilage, and it is articular cartilage, meaning cartilage in a joint. Remember, an articulation is a joint. So this articular cartilage is found on the ends of long bones and in joints. So you have a piece here in the glenoid, and you have a piece here that covers the entire head of the humerus. This cartilage prevents wear and tear of the bone. Cartilage is extremely tough, thick, and by itself, it offers a layer of protection on the end of the bone. But you see this black in here, all the way through this. It looks like it's empty in there. It's not empty, that's fluid. Synovial fluid, specifically, because this is a synovial joint. There are cells that line this entire area that make synovial fluid. So you're constantly making synovial fluid within that joint, okay? And the synovial fluid is WD-40 for joints. It lubricates the cartilage so that it just slides nicely along the other piece of cartilage and you don't get any real rubbing. Any kind of friction in there causes the cartilage to wear away and to start sticking. And it creates pain and inflammation, and that's basically what arthritis is. Okay, so you've got synovial fluid in here. So it's not empty. Now, the other thing I want to show you are these right here. Let me see, I'm gonna color them in here. This, and this right up here. Those are labrums. What they do, well, let me tell you what they are first. They're pieces of cartilage, okay? And I'm gonna clear this so you can see them. So that's a piece of cartilage and that's a piece of cartilage, and it's different than articular cartilage because it's not the same kind of cartilage. It's tougher. This and this, these labrum here, actually extend the fossa. You see that? They create more of a C at that joint so that the head of the humerus has more to fit into. So these are pieces of cartilage that extend the glenoid fossa. And because they're cartilage, they can be torn. So if you have a client who has a labrum tear in their shoulder, it's either this one or this one. It doesn't really matter for purposes of massage which one it is, but that's what a labrum is. You have them in your hip as well, okay? And then you can see all of this around here, and then all of this up in here. That's all the articular capsule or the glenohumeral ligament, okay? That's all of that. That's holding that whole thing together. Now, of course, you do have muscle here. There's the deltoid, right, just outside of the bone, or just on the other side of the bone. And you also have a muscle here that we haven't studied yet. The last thing that I want to point out on this illustration is this right here. Okay, so it's black on the inside, so you can tell that it has fluid in there because that's how these illustrations work. There's fluid in there, but it's not within the joint. This is something called a bursa or bursa sac. Bursa sacs are basically like water balloons, okay? They are filled with bursa fluid, so it's not synovial fluid. And of course, the internal section here has cells that make this fluid. And what bursa do is they prevent tendons and muscles from rubbing directly against bone. So it's kind of the same thing as I had mentioned before with the fluid-filled sac around the tendon for biceps, except that the bursa sacs sit in between two structures. They don't surround structures, they sit in between two structures. This one happens to be the subacromial bursa, or sometimes it's called the deltoid bursa because it's underneath the deltoid. The subacromial bursa is one of the ones that I think is a little bit more well known, although you have bursa all over your body. It's just that this one is important not to hit. So when you get a shot, for example, either a flu shot or an allergy shot or whatever, the nurse has to inject it lower than the subacromial bursa, or they risk actually injecting it right into that area and causing an inflammation in the subacromial bursa. So that's kind of a problem if that happens, which is why you get shots down here intramuscularly in the deltoid. Ooh, I'm still drawing. Whoops. All right, let's take another look at the shoulder. This, of course, is a lateral view. So we've taken the humerus off, we've set it over here, and now we're looking at the shoulder like this, okay? So of course, here's the acromion process, here's the coracoid process, here's the subacromial bursa, right there, all right? And right in here, this yellowish part, that is the top part of the glenohumeral ligament, okay? And you can see it says superior glenohumeral ligament. Remember I said that each section has its own name? Really doesn't matter because it surrounds the whole thing anyway. This would be the middle glenohumeral ligament, and this would be the inferior glenohumeral ligament down here. Either way, it makes a complete circle around the joint. Okay, so if we're looking at the inside here, here's the glenoid cavity, right? And this is the cartilage that's on the glenoid fossa there. Okay, just to give you an idea of what you're looking at. This would be the long head of the biceps, and of course it's cut because right here would be the supraglenoid tubercle. And then all of this in here is articular cartilage for the head of the humerus. Okay. So again, just kind of giving you an example or another view of what this looks like on the inside. And then last but not least, here it is. Okay, here is the entire articular capsule. This is all glenohumeral ligament. There's the superior, there's the middle, there's the inferior portion. Okay. And of course, all the muscles in this area are cut and reflected so that you can see the articular capsule. Now, we're going to be talking about disorders like dislocation, subluxation. We're going to be talking about that tenosynovitis that I mentioned earlier. So you want to be looking at these images in your book. They're on page 102 and 103 when we talk about those disorders. All right, that's it for the ligaments of the shoulder. It is a lot more involved, and you'll see images in different textbooks that have even more ligaments labeled. I'm not concerned that you know every single ligament in the shoulder. You really should know the major ones, especially the glenohumeral ligament, and the ones that hold the bones together, like the acromioclavicular ligament. That one is helpful to know as well. But I don't need you to memorize all of them. Okay. Have a nice afternoon.